This podcast is part of the Everyday Heroes Podcast Network, the network for first responders and those who support them.
And welcome back to Scissors and Scrubs.
Mm-hmm.
I'm Nicole.
I'm Laura.
It's the first day of daylight savings, so the sun actually set at a normal time today. I'm very excited.
So nice.
Though my girlfriend in Arizona is now 3 hours behind us again.
Oh.
Which she's like, oh, I'm out in a t-shirt tonight. It's warm. I'm like, I hate you. I really hate you right now.
It was sunny at 6:50 still.
Yeah, I was like, it's 35 degrees. It feels like it's 15. It's freezing out right now. So we're in the weird months of April. These will be coming out in April at the end of March or something, because of course we're recording ahead of time. And we're going to talk about a very hot topic today, which is we've actually started a new, we're revamping not our image. What are we doing, Laura? We're like trying to put ourselves out there more.
Get more, what do you call it? Like a social media
presence. We're getting more of a presence.
Yeah.
So we put this out there on social media and we heard a ton of feedback. We got a few emails and some Facebook posts, and it's a real thing. We're going to talk about nurses eating their young. That is a real thing.
It's a real thing. And it's sad. It's just sad to me.
It's sad, especially after I read some of these emails. I was fucking horrified. And you know, when I was reading and writing some of it, I was starting to think about how much we see it at work, to be honest with you. And it didn't dawn on me, but I'm seeing this every day.
You do see it I don't think you think of it, and then you're like, no, wait, that person, like when they do this, that's bullying
the critiquing
them,
and I'm seeing it every day. So what does nursing eating their young mean? It refers to bullying and harassment that is victimizing nursing students, and most generally perpetrated by older and more experienced nurses. Quote from Katz, 2014. To name a thing is to take its power away. So calling it nurses eating the young means like, oh, well, it happens to everybody, no big deal, and really takes away the power of this is bullying.
Right.
60% of first-year nurses will quit the profession because of this.
Are you kidding?
According to American Nursing Association, 2012.
Wow.
70% of student nurses experience bullying completely.
Wow.
Dr. Cynthia Clark is an expert in fostering civility and healthy work in the environment. She classifies nursing eating their young as incivility in the workplace.
Yeah. And
so you have to get into these subjects. My microphone's really low, and I'm afraid to hit it because it's going to make it go bump, 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 but I'm getting lower and lower as we're talking. So incivility is behaviors that are directed towards another person which are rude, disruptive, intimidating, and undesirable, which is every day, every shift, all the time.
Constantly.
Examples of incivility would be finding fault with the person, intimidation, sarcastic or condescending remarks. I don't know who would ever say something.
If you're from Boston, sarcasm doesn't count as bullying.
You're being bullied by everybody. Your 3-year-old bullies you because sarcasm is
it's
right
like
here.
a way of life. That's not,
Alienating and ignoring, attacking and punishing, gossiping and spreading rumors, unfair work assignments, cliques, hostile or rude physical gestures, withholding...
Not nice.
Never do any of that. No. Withholding info. You have famous last words. You got everything you need. You're all set. Got everything you need.
Yeah.
Scapegoating or backstabbing, and refusing to
help.
Yeah, that's what it actually says. Refusing. Good job.
Thank you.
Thanks for reading and deciphering. Refusing to help, not to keep. Many nurses feel it's a rite of passage or just part of the culture to treat each other this way, and I will agree because we see it
it's constant.
Every day we're seeing this. In nursing, the lack of awareness of what they are doing creates a group mentality and creates a lack of responsibility for the behavior. So you see it every day. You're like, whatever, yeah, it happens to all of us. What's the big deal?
It happened to me, so I'm going to do it to them.
Yep. The consequence is that the victim becomes a silent witness and doesn't usually speak out against behavior, so the behavior becomes acceptable. Because you get that whole feeling of, well, it's a rite of passage. You know, this is what we all do to each other. I have to just suck it up for a year, and once I get, a little experience, they'll leave me alone. And it's not right. That's not the way to nurture experience and bring up the new people coming up. You wouldn't do it to your children this way. You shouldn't do it to brand new nurses either. Effects of this: you're going to have difficulty in recruiting or maintaining staff, high turnover rates, job I was going to say declassification, but that's not the word I wrote. No. It's dissatisfaction.
Yes.
Lack of engagement and low morale.
Yes.
So, who does the bullying? Bullying is seen at all levels of nursing across all ages and gender. I'm seeing this a lot with some of the older nurses, because I'm seeing a phenomenon that some of the older nurses, they've been in it 40, 45 years, they're starting to slip a little bit. You can see them slipping a little bit. And the younger nurses are latching onto that and crucifying them for it.
Yes.
And some of them, their behaviors, the older nurses, their behaviors could be difficult, but the new nurses are, again, crucifying for them, and I don't think that's right either.
Yeah.
Younger versus older. One department ganging up another, like maybe the OR and the PAC you haven't added, or the OR and the ICU haven't added, or the OR and the ER haven't added, or the OR and the floors haven't added. The OR basically fights a fucking everybody. So we have nursing stereotypes. We got the super nurse. Everybody's got a fucking super nurse on their floor, right? Is often more experienced or specialized than most, and communicates a sense of superiority through an elitist attitude, condescending manner, and corrective comments. You have the resentful nurse. I hope this is me. Develops and holds grudges, encourages others to gang up on the transgressor, and tends to create drama that can permeate the work environment. Now, I'm going to tell you, you can see one of these in every workplace.
Oh, yeah.
The PGR nurse uses put-downs, gossips, and rumors, PGR, to bully other nurses. It doesn't say what PGR means. Passive aggressive?
Gossip and...
Put downs, gossip, and rumors. Laura, you're wicked fucking smart. See, she's bullying me right now. And it's often quick to
I'm using corrective language.
She's the super nurse. Laura's clearly the super nurse. So she uses PGR to bully other nurses and is often quick to take offense to a neutral remark. The backstabbing nurse. Ooh. Everybody's got one of these. Quote unquote two-faced. Cultivating friendships, and then they betray, using information as a weapon to enhance their power. The green with envy nurse expresses bitterness to those who have what they do not. Looks, status, personality, possessions. Their victims often do not realize that they are a target. I can see that.
Yeah.
I can see that all day long. The cliquish nurse uses exclusion as a means of aggression, showing favoritism to some while ignoring others. This came from the American Nurse Association in Del Sega, and it's used with permission from this article. All right? Okay. So, there are 3 roles for nurse bullying. You have the bully, or the perpetrator, the victim, or the target, and the bystander, who witnesses, which...
And doesn't.
I'm going to say 90% is the bystander. Everybody sees it, and you just don't say anything about it. Leadership can contribute to the environment. Superiors and managers who lead by intimidation foster that behavior in their staff. Nurses in management roles often adopt leadership styles based on bad bosses of the past. So it's a big problem, as we've discussed. All right. So there are ways to deal with it that I think we'll discuss after we read some of these emails that we got in, because I know I give these people who wrote in courage. They don't want us to use the names. I don't blame them, because it takes a lot to put this stuff down on paper, and it brings back a lot of bad feelings. And some of these stories that were written in are horrific to me. I mean, we've seen it, but I have never seen anything to this extent.
No, you would have to say something.
This is ridiculous. And how people didn't say anything is unbelievable to me. So why don't you read one first?
Okay. I'll go with this one. So I'm just going to read it. I'm going to leave out her name. Hi, ladies. I love listening to your podcast. I had posted last week on your Facebook page about nurses eating their young. It happens to Surge techs also. It's awful. I'm a newer but older age tech, so she started being a tech at an older age. I am also a clinical instructor. After I graduated from my program, I started working at a level 1 trauma center. I was welcomed by another coworker who was younger than me and took me under her wing, showed me around, precepted me, helped me. We exchanged numbers, and she said to text her if I needed any help. I thought it was great. I started to get noticed and came off orientation pretty quickly. Started taking bigger cases. The doctors would be happy to see me in the rooms. Well, she got upset. She keyed my car.
Holy shit.
Which I could never prove, of course. Hospital parking garages have surveillance, just not recorded.
Yeah.
She then sat at a lunch table with a bunch of my coworkers and proceeded to spill all the things and insecurities I had to everyone. Thankfully, someone did come and tell me. I still work at the hospital, and she no longer does. It also happens with the students that I have to place in rooms. With experienced techs, they give them the silent treatment, won't let them do anything, and these poor students who are scared and nervous to begin with have to, quote-unquote, prove themselves before they are given any kind of help to learn. It's frustrating. Just be nice. Teach them. They will be working next to you one day. Also, if you could...
Don't use my name.
I love your podcast. I've listened from the beginning. The stories about fires and the history of surgical stuff, I tell my students to listen. Thank you. Thank you for all you both do in this crazy healthcare world we currently live in. Well, thank you very much for writing in, and that is...
It's ridiculous.
Horrifying.
But you know what? You see it
But
all
that's
the
that
time.
green with jealousy nurse.
Yep.
That's that, what was the
That's
other
a backstabbing. She's real friendly to your face.
She takes all your information and shares it with everybody else.
Yep.
She's like all those
all
types of nurses in one.
But you see it all the time. Nurses, I mean...
Or techs.
Regardless, either I mean, they want to be the big shot, and they get really intimidated if somebody new comes in. I mean, I can see it sometimes myself. Like, I can be very standoffish when you first meet me.
Yeah.
I mean, because I gotta see what you're all about first. And we had one nurse come in nights, and I had only had one experience with her when she came up to me in the lunchroom. Never met her before, and she starts grilling me about Botox and how to do Botox. And I was like, who the fuck is this girl?
Yeah. Who do you think you are talking to me?
Talking to me? Let me eat my lunch. Who are you? So then I hear she's coming tonight. I'm like, oh, great. Fucking great. I could not love this girl more if I tried.
Right.
She wound up being one of our closest friends. I have so much fun with her. But my first inclination was to be like, I'm done. Don't get away from me. But I couldn't love her more. She's hysterical. She's good. She's funny. I just love her. So that taught me a lesson, and I try, to squelch that part of me down that wants to immediately be like, get the fuck away from me. And I tried to give everybody chances. Not always easy, and some people prove me right. But that being said, we're going to move on to the next one. Okay. Another one, please don't use my name, so I will not. I started my career in July of 2020. Oof, right in the middle of COVID. Yeah. I'm obviously a baby tech, and I'm still learning a lot. I was hired by the only level 3 trauma center in the immediate area and moved out of state for the job. The person designated to train me at my new job was described to me as gruff. I think that's how people describe me. I really don't think she knew how new I actually was, but whatever. Everything started out fine, but when she started to berate me and talk down to me in front of surgeons, I kept my mouth shut, as I was still on my probation period. But then I was being told that she would walk out of the OR and start screaming down the hallways about how stupid I am or talking shit on me to surgeons. I stayed quiet because she controlled how long my probation period was. She taught me to do this. Fucking pisses me off. She taught me to do things incorrectly, knowing I would eventually get in trouble, say it was her that taught me, and look like a liar. And that's exactly what happened and continues to happen. Oh, that's good. Teach her the fucking wrong way to do something, because that's not dangerous.
I mean, at the end of the day, there's a patient you're taking care of.
What kind of piece of shit are you to do this?
Why do you care if someone else that you should want everybody to do it the right way?
Exactly.
Like, why would you ever...
Common decency for the patient on the table.
Right. We're healthcare workers.
Right. And all I'm going to do is say, you trained me that way, which is what...
Right.
This went on for about 3 months before someone else spoke up about it. I was assigned another preceptor, but she was already pissed off because now she's listening to this piece of shit.
Right, just has it in her head that she's terrible.
Over the past nearly 2 years, she has pushed me out of rooms and taken over my scrubs. Refused to give me breaks at all, or let me give her breaks. LOL. Okay, starve then. Sending complaints about me doing stupid things like dancing in the OR during turnovers, making it sound like I'm doing it while it's the patient's in the room and awake. Okay, maybe I dance in the OR, but the patient's asleep. And who gives a shit if you're happy in this climate of nursing where everybody's miserable?
Right.
Who cares?
Right.
She also someone has turned everyone against me. I'm now leaving. That's a shame. That's a real shame. Now, I get it. Well, if anyone hates you, it's probably you, right? No. This is a small community where everyone knows everyone, and when someone that's not from around here comes into the community or the department, they do this. I'm not the first one that's leaving because of her, and now she's latching on to someone else. All the travelers are having issues with her, but no one wants to say anything to the boss. She's made my life a living hell for the past 1.5 years, and now I'm going back home. That's really sad to me. And having traveled and worked in smaller places, we are fortunate we work with a ridiculous amount of nurses. These smaller community hospitals, one person hates you,
Yep,
you're
they're
fucked.
done.
You're fucked.
Mhm.
So
and that's too bad. I wish that person who wrote that would like call the administration of that hospital since she's leaving,
go to HR.
right, and say she's actually teaching the wrong way to do things, so she looks good, but she's endangering patients. Like
Yeah.
like regardless of the bullet, which is terrible,
Right.
terrible.
And the
to
self-esteem
act like
issues
that.
this poor girl probably has
Right,
now.
and then you second guess. It's
Yep.
awful. But never mind that if they don't want to address bullying, this person could be bringing harm to patients
Right.
because of this. Like it's
And really, what do you get off doing that? Like, how does that make you feel like a big shot?
Right.
You know, I would be, in fact, we teach, we
Yes.
do this.
Mhm.
I am happier when I hear they're doing a great job
Yeah.
because I taught them that.
Right.
You know,
'Cause that
I think
makes
that
me
makes
look
me
good.
look better. is
Right.
They're doing great in a room.
They're terrible. I taught them so
Yeah.
great. Like you don't want them to say they're
Right.
terrible. I want every time someone's like, "Hey, they did a great job." I'm like, "Great,
I
I'm
feel
so
good.
glad."
Yeah, we're doing something right.
Right.
Yeah. Oh, it just, that pisses me off. So go ahead.
Yeah. All right. So this was on one of our Facebook posts. I asked for stories. So this person writes, I had a terrible bullying experience when I was a brand new nurse. My training schedule was 3/12s, but I was allowed 40 hours a week. So I asked if I could come in for those extra 4 hours and learn as much about scrubbing as I could. I pitched it that my pay was coming out of a different cost center, so I wasn't costing the OR anything to expand my skills. I was scrubbed in, standing by the back table with a gown in hand, waiting for the physician assistant to come in so I could gown her. The RN of the room, and most experienced RN of that OR, 18 years in, came in and yelled, "What the hell are you doing in here?" I said, "I'm learning about scrubbing and waiting for the PA." She said, "Get out. She's not even here yet," and started walking towards me. I took a step back and said, "Don't touch me." She continued to walk towards me and extends her arm and swipes her hand down the front of my body.
It's a contaminator.
So, if people who are listening to this don't know, you have a gown on, nothing can touch that gown
You're sterile.
unless it's another person that was scrubbed in with
It's
gown
sterile.
and gloves, and
Yeah.
they can touch you and they're sterile. But if you come at me and you're not scrubbed in, now I'm unsterile and I need to break.
It's a classic move people do to med students, interns, when they want them to leave the field. They'll go over it and they contaminate them, so now they have to break and leave.
So now, once you do that, this person can no longer,
Right.
they have to break and re-scrub and redress. So she wipes her hand all over the front of her body. You can't touch people. So of course I have no choice but to break scrub. I went straight to the manager's office and told her what happened. She tried to make excuses for her and tell me that I misinterpreted the exchange.
How do you misinterpret that?
How
do you misinterpret
Right.
that?
She right, like what the fuck?
Yeah.
Later that day, I was called back in there, and there she sat with the manager, and we had a discussion about it.
The manager was probably her best friend.
Probably.
Yeah.
She was so full of shit, saying she was just joking. It was all in fun, blah, blah, blah. And proceeded to say that she was the last preceptor I'd have to be with to get to go solo. So I said, okay, when you're my preceptor, are you going to hold this against me? She said, abso-fucking-lutely.
Oh my God! In front of the manager!
The manager laughed and said, abso-fucking-lutely, that's my favorite word. I can't. It was then and
Up
there.
to HR I go. You
Yeah.
fuckers.
It was then and there that I was awakened to how things were going to be. Now I'm the preceptor and she's gone. You'd
Thank
better
God.
believe I have never and will never do that to any of my preceptees.
Yep.
They're so... Why don't you want people to know more about the job? Why would you hold things secret? Why would
Because
you... Oh, I don't want you to... You shouldn't learn how to scrub. No,
because
she
they
should
might
learn how to scrub.
outshine them.
Right,
And
it's
they
just
can't
so-
handle it. We see it in our own job.
I know, it's just so petty. I just don't... I literally... I was talking at work recently to somebody about this. Like, they're like, well, they didn't... I don't know, they never told me that, but I feel like they don't tell me things on purpose. And I'm like, I just don't understand the point of that. Like, don't you want your coworkers to know just as much as you? Don't you want everybody
Makes
in the
my
room?
job easier.
Right. It makes everybody's job easier. Don't you want them to be able to do what you do so you don't have to do the hardest cases? You
But they
don't have to do
don't.
the most work?
They don't.
It's just
You
bizarre.
see it a lot in orthopedics.
Yeah.
Cardiac.
Yeah.
Cardiac is the queen of this shit.
I know.
And they breed it. And I don't mean it to our own cardiac scrubs because they're so desperate for help. I think they would teach the fucking janitor.
Yeah.
They would teach anybody how to
Yeah.
scrub. But I have been hospitals where cardiac's the elitist. I mean, when
Yeah.
I first started where we work, cardiac was ridiculous.
Yeah.
They were rude. They were mean. I'll never forget. This nurse is still there. She had started not shortly after I did. She started scrubbing in cardiac. And at the time, We had some heavy hitting surgeons down there. You didn't go to cardiac. The scrubs all had their own jackets. That's the cardiac team. And they all wore dresses. And they didn't talk to anybody but each other. They were fucking brutal. And they were so elitist, they couldn't do carotids on cabbages. So the main OR would have to go down and back up on the carotid. I get picked as the stupid fuck that's got to go down to cardiac and scrub the carotid. And the surgeon that I was working with was very intimidated by the cardiac surgeon whose case it was. So he's trying to show off. I couldn't breathe right. He was just screaming at me. He literally at one point told me the sponges were too bright. Like I have any fucking control over how bright my...
Sure, let me dim those. What do you want me to do?
Beside myself because I was still a pretty brand new scrub at the time. He's on me and on me. This woman, I have to this day will never forget. She would load the prolines and put them on my table. She was not one of the cardiac team, if you know what I mean. She would help me with this. She would feeding me stuff so I could, because she felt bad for me.
Right.
I never forgot that kindness. That was 27 years ago. To this day, she's almost in retirement. Anything that woman needs, I will get her. I will. You'll never forget the scathing remarks, and you'll never forget the kindness in that type of an environment. Because had it been any one of those other cardiac scrubs, they would have laughed at me for failing. So, Catherine, I love you. I'll never forget you. So it's just why? What purpose did it serve berating me and making me nervous? It didn't make me get you anything any faster. No. All you did was freak me out.
It makes it worse.
It makes it worse, and they don't understand that. The same surgeon, years later now, I'm a nurse, have scrubbed up the wazoo, working nights, had started doing an endovascular AAA, and it turned open. The circulator in the room is one of the older nurses who's kind of slipping a little bit, so she really wasn't on her game, and the scrub wasn't strong at it, and he was all over her, like white on rice, man. He was berating her. I threw my gloves on the table. I said, go take a break. She's like, I said, just go take a break. And at this point now, he and I have established a relationship over all these years and many horrific cases. He finally is comfortable with me. And the thing with him is the reason he berates is he's not comfortable with who's in the room. Right. Once he knows you, he calms down. So he starts calming down. And I said, do you think screaming at her was going to get you any faster? And he's like, well, I just need I said, I appreciate, but you also don't realize the nurse wasn't getting her anything she needed. Yeah. It's not her fault. Right. And I was all over him. That girl came back from break. He's like, I'm sorry. I shouldn't have talked to you like that. She was like, I can't believe you just apologized to me. I'm like, because you didn't deserve that. Right. That was bullshit. Right. So, all right. Anyways. All right. This is the last and final story. Okay. And it's a doozy. And it makes me want to drive down to where this girl works and beat the shit out of the entire hospital staff. That I read this. I was livid. Yeah. I was livid. Again, I can't read the names. But the printing isn't a way I can read it without my glasses, so thank you. I am a huge victim of the typical nurses eating their young. I am currently 25, but when I was 23, I started my very first nursing job as an RN in the CVICU. I was the only, so that's the cardiovascular ICU unit for people who don't know. I was the only female on the entire CVI and CV step-down that was under the age of 40. Wow. Also, I know, really. So you take an old crone to have to work that job, I'll tell you. Also, I am tiny and blonde and in parentheses, sorry, because I know this will make me sound like a douchebag, but pretty damn hot. Needless to say, I got hit pretty hard by that shit. And I will say you see that too. Yeah. They immediately assume you're pretty, you're stupid. I don't know why that is, but and they're intimidated by your looks because then they're going to be like, oh, the doctors just like her because she's pretty. Right. Oh, the doctors will only be nice to her because she's pretty, which sometimes they are. I started with an older nurse going around telling people, watch out for her, heard she's bad news. A male nurse practitioner started to sexually harass me at work. He literally wanted to, quote, eat his young, fucking filthy pig. Ew. If you catch my drift. He would corner me in rooms, not give me orders on patients if I didn't flirt with him, touch me. I don't know how this happened. Touch me inappropriately, wait for me in the garage after work next to my car. It was bad. That's when shit really hit the fan. This old nurse started taping shit to my locker. She was actually my preceptor for about 2 weeks, and I bought her a gift, which she later put in a plastic bag and taped to the outside of my locker. would call me bitch and slut when she walked by me.
Oh my God.
I just can't fucking believe this happened. She even sent me a text message saying that you have no critical thinking skills. Your time management is shit. You're not meant to be a nurse. You should go into medical sales. Because she's pretty. Because she's pretty. I politely responded to her and said, thank you for your feedback. I couldn't have been this nice. I'd have been like, you cunt! Thank you for your feedback. I will work on my time management. I hope one day I can change your opinion of me and prove to be an excellent nurse. God bless you, honey, because that's not the answer I would have.
That's the high road. That's the high road.
That's way the high road. My critical thinking skills would have been plotting how to take her out.
Oh, watch these critical
Oh, I would have critical think my ass all over you. I have screenshots of everything. Even a recorded phone call of her drug ass telling me I had ruined their unit. I don't know if it's drug ass or drunk ass, but either way, it's not good.
Intoxicated ass.
Yeah, her intoxicated ass. I received 4 Daisy Awards within 8 years of my first year. 8 months of my first years of nursing. I have not received one in 30 years.
That is like a
ridiculous.
very high
I don't get
honor. Like, you have to really be like a standout.
Laura, it was because she was pretty.
Obviously.
All right, clearly.
We're kidding.
We are kidding.
That's like a really high honor
it's
for
amazing.
People who don't know.
It's amazing.
To get 4 in 8 months, that's insane.
She then messaged my husband on Facebook and told him, like this fucking bitch. She then messaged my husband on Facebook and told him I was having an affair with an NP at I'm assuming that means work. Then started a rumor that I did drugs at work. Like, you are ruining her life now. You have fucked with her personal life now. What? I'm telling you, this bitch had it out for me. I was so concerned about my job and safety, I finally went to HR and made a report. I can't believe you waited this long. Mm-hmm. Reported everything to my unit director, the ACNO, the CNO, Chief Nursing Officer. Nothing was done. Nothing changed. That shocks me even more.
That's awful.
I'm telling you, the whole hospital thought I was a whore. My orientation friends stopped talking and hanging out with me because they didn't want to be associated with me. That's Shame awful. On them. Yeah. I'm sorry. I continued to come home crying after work every day. My husband wanted so badly for me to quit, but I refused to back down.
Good for her.
I put up with it for a year. I don't know if I could have done it.
I know.
I truly loved my job and was learning so much in CVICU. But she and the NP had so many people against me. Of course everyone hated me instead of the male NP. He was so obsessed with me that his wife actually divorced him. Wow. Of course the whole hospital, I'm a homewrecker, not him. Finally, one day I was on the unit and they came and pulled me off to, quote, randomly drug screen me due to a nurse's request. I was so I am just getting more living. That is bullshit. Awful. This is bullshit. You have no backing that she has any drug issues. No,
but it's just this woman saying this
What
bullshit.
proof did you have? Right. Of course, she probably lied and came up with bullshit answers. I was so humiliated. Of course, I complied and did the screening, which came back negative. But I was so pissed and so done and so fucking embarrassed that I put in my notice the next day. This really impacted me. I even went to therapy. Yeah, I hope so. I will still to this day tell you that I learned so much from the 2 weeks I had being precepted by this woman. And the reason I was so hurt was because I knew she was so brilliant and I wanted so badly for her to like me. I never said a single bad word about her, even as she was screaming at me at the nurse's station, was talking about how I was going to get certified in CRRT. I have no idea what that is, but I'm assuming it's some kind of respiratory therapy. Yeah. She was trained to take fresh hearts, and I wasn't yet, and she got so angry anytime they would try to train me on anything. When I received my first Daisy Award, someone congratulated me at the nursing station. She said, yeah, that's a sensitive subject around here. Really? Why? I haven't received one in ever, and yet I congratulate everybody who gets their excellence awards and their Daisies. You trained
her.
Right. So you should be proud.
That says something about you.
Right. Bitch. Yeah. And then stormed off. I guess because I had only been a nurse like 6 months, and she had been one 15 years and never had one.
Well, when you act like a bitch, no one's going to nominate you.
There. Shove your daisy ass up your award, you little. I probably only had 5 people in that hospital that truly knew me and had my back, and they were the type of people whose respect had to be earned. But they knew me and knew I was not a horrible person. I have since moved on to another CVICU and am happier, but miss a lot of my old co-workers. Eating your young is never okay. Let us learn from you, love you, and we will show you so much gratitude and always help you with a code brown. That's for the med students, honey. Yeah. P.S. I'm from Georgia and not sure which one of you has the laugh where you sometimes wheeze, but that and the accents are literally my favorite thing in the entire world. Please wheeze more and keep us laughing. I'm the wheezer, FYI.
I don't think you wheeze.
When I get caught off guard, like the penis episode, and it's quiet for a minute because I'm
Oh.
like laughing so hard. But it has to be something that has completely caught me off guard and I'm hysterical laughing. And then I can't. It takes me a minute to get my sit. So, in my Boston accent, that probably I hope came out as harsh as it should have been, because that was the worst story I have ever heard.
And the fact that people just sit there and don't
watched
say
it.
anything.
Yes. You stop talking to your friend because you don't want to be associated with her.
No, you should be saying, but that's not true.
That's not who she is.
Friends with her.
Right. You should have backed her and given her support, and probably one of the worst things she's ever had to go through.
Yeah.
That's a horrible experience.
That's awful.
And I'm ashamed of the nurse who was her preceptor. Mm-hmm. She should be ashamed of calling herself a nurse and a preceptor.
Yes.
Because that's fucking ridiculous.
It's awful. I don't understand it. I just don't understand it.
I don't. Like I said, after doing this, I'm really looking at stuff at work, and I see it. I see it happen all the time. One of the students we're precepting right now came in and told me a story about, she's almost done. I mean, at this point, you know how to open gloves. You know how to do, and the nurse in the room, which I didn't expect it from, ripped her apart while she was opening gloves and tell her, you're in my way and this and that. And I get we're all burnt out. Yeah. We're all frustrated. But you have to be just human decency. It is not okay to talk to anybody to berate anybody like that. No. The surgeons are not, when we first started, it was worse.
Yes.
The environment was a lot worse. I do think things have changed significantly. Mm-hmm. As much as I hate to see it, I think that's also changed how people work. And nobody's going to agree with me. You know what I'm going to say.
I do.
All right. Like having scrubbed in the 90s, the surgeons screamed at you if you did something wrong.
Like they were going to murder you.
Yep. But you never did it again.
You never remembered.
Right.
Oh shit, I can't ever do that. Or
right.
Oh, this stitch has to be this. Or you always remembered whatever the hell they screamed at you about.
If they threw a needle holder back at you because it was filthy, you never gave him a filthy needle holder again. If you ripped the proline by accident and he humiliated you, now I'm not saying that's the way to do it.
No.
But what I'm noticing today is because that's not the reaction they're going to get, they don't give a shit.
No.
They don't give a shit.
No.
And I'm always like, pay attention. Do this. Do that.
Yeah.
You got to clean this. And they just don't care.
No.
And that's just as frustrating.
I know.
So look at all the new students coming out there. It's not.
It just doesn't. So I'm going to talk about burnout and people bullying new people coming up, or even not new people bullying older people that have worked there for a long time but think they're stupid. They're not stupid. They have so much knowledge.
They have more knowledge than you'll ever know.
Right. But doing it to anybody is just going to cause everybody else to have more burnout because you're getting rid of these people.
What pisses me off the most, and I tell all the new people not to do this, when the scrub throws the circulator under the bus. As soon as they leave the room, she's like, well, I asked her for it. I don't care if you hate her.
Yeah.
It is you against them. Because that surgeon will throw that bus over you anytime. Mm-hmm. And we had we have a couple of them do it all the time. And I'm like, you're going to work with her for 30 years.
Right.
We work in a teaching hospital. They come and go like underwear. They're in and out, in and out, in and out. He's going to be gone in 6 months. Right. She's going to be, you'll be at her retirement party. So you better be nice to her. Yeah. Or they're going to sabotage you.
Yeah.
It is what it is. Mm-hmm. You can't fix the culture overnight, but stick together.
Right. There's no need.
I hate when people do that.
Throw people under the bus. There's
no need. Even some of them I want to.
Yes,
but I don't.
No,
because it's to me.
I say, okay, give them a minute. You just asked for it.
Yeah,
they're trying to put it back on them.
Yeah.
Okay, well, you just asked for it. She had to go get it. It takes a minute.
She's crawling around under the drapes. Right. You got to give her a second to do the 4 other things you just asked her.
Even if it should have been done, so whatever. I'm still gonna say you just asked. You got to give her a minute. Yeah.
So stick up for your team in the room with you. Stick up for them because you're all in it together. And the one common denominator is the patient. You're there to take care of a patient.
That's the thing.
Beating each other up isn't going to take care of the patient.
No. Are you in this like you're a nurse or you're a tech or you're a healthcare worker of some sort? Do you not care anything for the patient? Because if you don't, you shouldn't be doing the job.
Right.
You shouldn't be doing the
job. Is
job.
your ego bigger than making sure that patient gets out of here safely?
Right. And someday I'm not going to be working anymore, right?
Right.
But I'm going to need somebody to
take care of me,
operate on me.
I'm a little afraid of what's coming up.
Right. But And if I'm not teaching them my knowledge, how do I...
Right.
Why would I want them to not know how to take care of me?
Right.
Why would I want them to not know how to take care of my kids? Like, why?
I mean, we work in a trauma facility. They need to know how to deal quickly with stuff.
Yes.
Because patients will die.
Yeah.
And if things don't go well for them, I'm not going to berate them for it. I'm going to try to talk them through it because we see some bad shit.
Right.
It's not going to help if they leave. There's already a nursing shortage. We got to try to build these people up. It's fucking pissing me off.
This
whole episode made me angry.
So, going from that, bullying people, I'm going to talk about nurse burnout. Because if you're bullying everybody, it's just adding to the nurse goddamn burnout.
These girls are burnt out. They're 2 years in.
Right. They're literally... Right.
They've been
what
through
she
war.
said, 2020, one of them
Yeah.
said.
She's already burnt out.
Yeah.
You know?
That stress and the emotional toll that takes on you. Anyway, so nurse burnout is an occupational hazard that affects not only nurses, but also patients, organizations, and society as a goddamn whole.
Mm-hmm.
It's not just about, oh, that nurse is tired or...
No.
It affects everything. It's associated with worsening safety and quality of care, decreased patient satisfaction, and nurses... in like a decrease in nurse commitment and productivity. It is defined as emotional, mental, and physical exhaustion caused by excessive and prolonged stress. It is now an official medical diagnosis.
Oh, absolutely.
Some causes of it are long work hours. There's studies that indicate that working a 12-hour shift is harmful to both nurses and patients. The longer you are there, the more burned out you will be.
But that's nurses do it because they only have to work 3 days.
3 days, right. Greater workloads. Nursing is becoming more, well, everything is becoming more and more high tech. There's more and more things you have to do other than just your nursing role.
Mm-hmm.
You have to be an IT specialist. You have to, know how to fix these machines that you've never seen in your life.
Where does this cord plug into?
Right,
How do I put this on the screen?
Everything is getting more and more and more
intense.
That expectations to provide a higher level of care are increased. Like you have to do more. You have to do more. You have to do more. Nurses are having a harder time focusing on just nursing.
Mm-hmm.
Like our basic role is like disappearing.
More paperwork, more documentation, more documentation. Document this, document that, document this. It's like, holy moly, I got 5 seconds to talk to this patient.
Right. And this leads to frustration. Obviously, everybody's frustrated. And the inability to do their job to the best of their ability. Because you have to focus on everything.
A million things.
Other than the patient.
Mm-hmm.
It's sad. And obviously the death and sickness you see, which is part of being a nurse.
Yeah.
You are going to see sickness. That's why we are nursing these people. And you're going to see death at some, I mean, maybe not everybody, but most nurses are going to see death at some point. But that doesn't mean because it's part of your role that it doesn't take a toll on you. And I think a lot of, like during COVID, these nurses who don't see it every day had to go to units where they did see it every day. And it was sad because no one could even be with them. So they were with them. And the emotional toll it took on people left. I mean, it was a mass exodus.
After effective COVID on the nursing field is shocking.
It's like devastating.
It is shocking.
Yeah.
And, people don't realize a lot of the hospitals in this last shutdown of hospitals, it wasn't COVID. There's no nurses.
Right.
And they don't know that.
Right.
There are no nurses in these hospitals.
Yeah.
And the ones that are there are being worked to death.
Yeah. It's
bad.
Very
it's really
stressful
bad.
time. Signs and symptoms of burnout are exhaustion, anxiety, frequent illnesses, headaches, muscle pain, a change in appetite, a change in sleep, feeling helpless, a sense of failure and self-doubt, detachment, lack of motivation, cynicism, decreased career satisfaction, become withdrawn.
All right, I've got about 8 of those.
I know. Isolation, procrastination, frustration, substance abuse, and missing work.
Mm-hmm.
It affects patients in the long run
because
a burned out nurse is more likely to make poor decisions at work. They have a lack of sympathy. They're cynical, and they have a lack of sympathy towards the patients, which leads to
they're going to be short with them. Yeah. They're going to yell at them.
And okay, so we're in the OR. We don't talk that much to our patients. A nurse on the floor, even on a regular med surg floor, when you discharge a patient, you're giving them instruction. This is what you need to do at home. This is if you're burnt out and really don't care, you're like, yeah, okay, sign this,
Yeah.
you're leaving. Like,
You're out.
like, you're not giving the care you should
Because
be.
guess what? You're going to have another one in that bed as soon as this guy leaves.
And you're just done.
Yep.
You're like, oh, they're leaving. Now I got to do this whole
Yep.
onboarding. And,
Yep.
so they're not giving, and it's not, I'm not blaming them. They're burnt out.
Mm-hmm.
Like, but you're not giving the care you should be giving. Even just simple things, you're not doing it. The patients aren't getting the care that they deserve to get. Staff shortages make patient to nurse ratios higher, which leads to negative outcomes. There's more mistakes. There's less time to, care for the patient. Patients feel like there's nobody here. No one's care. Why am I even here? Burnout affects 38% of nurses every year. That's like more than a quarter of nurses have burnout every year, which means.
And I think that's a low number.
Yeah, probably is. But this breakdown was like, wow. 4 out of 10 nurses drive to work dreading their shift. 4 out of 10.
Every single day.
I know.
I think I could just stay on 95 and go to Florida right now.
4 out of 10 experience a lack of empathy. 4 out of 10 nurses have a lack of empathy. And 4 out of 10 nurses, because this is the 38%, 4 out of 10 nurses are dissatisfied with their profession. That is a sad,
very sad
number. And that's like the information on
I'll say
burnout.
Right after we came back up with COVID, I was losing my mind, but we got an influx of young, fun nurses come on the shift, and it helped.
Yes.
They helped a lot.
Yes.
I don't think they can even appreciate, of course, half of them have already left.
I know.
But I don't think they can appreciate how it helped the shift and just brought energy back, and people were kind of like a little excited to come to work because you knew, like, oh, the kids are going to be there. And
I think, honestly, helping them learn
was fun.
And everybody said it. Like,
Yeah.
I had them in the room today. It was nice because, like, I forgot. Like, so I told them, this, and, like, I forgot how much I like to do that.
Right.
It's nice to teach people.
Yeah, when you do it right.
Yes. Like, if you're doing it and you're doing a good job and you're like, oh, shit,
You don't realize how much you know.
Right. A, you're like, oh, my God, I know a lot.
I do know that.
And B, you're like, I like my job. I actually like my job.
I do like my job.
It's just,
I'm just fried.
You get in the dredges of it, monotony, and it's stressful, and, go here, do this, do that, do this, and everybody's so sick, but you forget the fundamentals of your job that actually makes you love it. But when you're teaching somebody, it brings that back.
Yeah.
That's why you should teach people enough.
Right. In a good way.
Right. So I have the 10 most stressful nursing jobs that cause burnout. I mean, everything is stressful.
We're not putting shade on anybody. No. Everybody in nursing has
this
a hard time.
article had, like, this person came up with these 10, but obviously everybody's going to be stressed. The most stressful, 1, adult critical care nursing. So this is ICU nurses.
Oh, all day long.
Yeah. It's typically, critical care is definitely seen as the most stressful nursing job. It's associated with the highest rate of burnout. The report showed up to 86% of critical care nurses have at least one major symptom of burnout syndrome, and up to 33% of them had all the symptoms of severe burnout syndrome.
I mean, think of the burn ICU. Could you imagine working in the burn ICU? No, I'm good.
It's awful. Number 2, pediatric ICU nursing.
Oh, another one. That and the neonates, forget it.
I know. One small study, PICU nurses spoke of unrelieved job stress as being the primary reason they chose to move on from the PICU. That is why they're leaving, because of all the stress that's constant.
You couldn't, between the families and the children and the stories
Not only do you
of
have
why
this very sick child,
yeah,
they also have to deal with their family and their parents, and it's awful.
Or when you hear the child is there because of an abusive situation or something, it's so traumatic. Like, people in nursing, I want to go to PD. I'm like, it's not broken legs and scraped knees. It's horrible stories of chemo or whatever. I couldn't give a 2-year-old chemo. I couldn't do it.
I know. I mean, God bless.
God bless these women out there. I could not do it.
Yeah. Number 3, neonatal ICU nursing, obviously. It's the 3rd most stressful nursing position. Babies are cute and they're adorable and you want to cuddle them. These babies are suffering. They're suffering.
These women are putting babies in a body bag.
Yeah. And you're dealing with the parents who are
traumatized.
It's the worst thing that can happen, and it's just awful. It's a terrible amount of stress. Number 4 is emergency room nursing. Obviously, they're seeing trauma. They're seeing exceptionally sick people. It's very fast paced.
They take a lot of abuse in the ER.
Yeah.
It's
Yeah.
like,
and then you have all the
they
psych
take
patients.
a lot of abuse.
And, I mean, it's
the drunks and the drug addicts and the homeless and
a lot comes at you all at once.
Mm-hmm.
In one multi-center study, emergency room nursing was found to be particularly stressful, not only because of the emotional, physical demands of the job, but also because nurses often witness aggressive or violent displays without being properly prepared to handle them.
Mm-hmm.
Number 5, operating room nurse.
Ooh.
Which I was surprised
We're
was so
dead
high
middle.
up because people...
I think it depends on the OR you're in, but you're also dealing with surgeons.
Yes, but I think people just... It's almost like we don't exist most of the time. Like, people don't know what we do. We're some part of the hospital that no one else can go to. They don't even know
we were
you're
described
open.
as what, the weird office in the mall where security hangs out. Nobody knows who's
like,
in there.
No one knows where the hell it is. You can't get in. It's in this article. It's like operating room nursing is completely different than floor and ICU nursing. It's a completely different profession. You only have to focus on one patient at a time, which is nice. And usually we have like regulated breaks. Where on the floor you don't really have like you're going to lunch now. Like. Right. We have, like, you go to lunch at 11:30, you go to lunch at 12, you go, we have a very schedule.
On the flip side, if we have to pee, we can't leave the room
you can't
unless
just
somebody gets us out.
But there's very stressful downsides to the operating room. It takes a long time to train in the OR.
Yes.
You don't learn this in school. This is all on-the-job training.
You get one day in school.
Yeah, if you're lucky.
Yep. And there's 2 major roles in the OR for nursing. Scrubbing and circulating.
Right.
And they both take years to learn.
Right. So then that's a lot of the stress is it takes so long to train and then you're on your own and you still don't feel like you really know what you do for years after that. So it's very stressful because you feel like I don't know what I'm doing for years. And second, most of the stress in the OR comes from the high amount of vigilance that nurses must have as they work in a sterile environment. You are always watching everything. Most ORs, quick turnover is, the pressure to, you get that patient out, clean the room, set up the room, get the next patient in. Like, why is this taking so long? Shouldn't take 15 minutes. You have to clean an entire room that had blood and guts all over it.
Make it clean and open new sterile equipment.
Right. Like, it's a huge, so the pressure, hurry up. We have more. It's always more. And then you have emergencies. There's very sick people. We get very ill people.
They scrape them off the sidewalk, maybe go through the ER and come to us. So we're all seeing the same thing.
Right.
All right. Whether it's a sterile environment or not, we're seeing some rough stuff come through.
And you're running on adrenaline the whole time because they're flying up. Yeah. You're trying to save this person's life.
And you got to get blood, and you're trying to help anesthesia, and you're trying to help the surgeon, you're trying to get the scrub squared away. You're running for this, you're running for that, you're plugging this in, you're trying to make sure you're documenting everything properly. Am I doing my time out? It's hard. Yeah. It's hard.
And one study showed over 90% of nurses called working in the OR stressful or very stressful. The 6th is critical care step-down nursing. You come out of the OR, the ICU, the ER. You may think that work will become far less stressful, and that's not true. The step-down unit, same sick people that literally were in the ICU an hour ago, and now they're on your floor, and they are sick as shit. They're generally stable, like they can move out of the ICU, but in a second,
they could be right back.
It's continuous monitoring. It's not a med-surg floor. You're still it's a constant monitoring. And they deteriorate really quickly, those patients on that floor. You think, okay, you're fine, and the family kind of feels like they're out of the woods. The patient feels like they're and then suddenly they're just as critically ill as they were. There's a high bed turnover because they go, get them to the floor. Nope, you got to bring them back to ICU. Like, it's a constant turnover of patients on that floor. 7 is oncology nursing. Obviously, it's very stressful. You're dealing with people in a very emotional situation.
Most of them are dying.
Yep. And it's not only inpatient oncology, it's outpatient oncology. You're still seeing these people that come.
And you build a relationship with them.
Yes, and they come for years, and they come every week for their treatment, and you form a relationship with them and their family, and then when they're no longer coming, sometimes they're cured, a lot of times they're not, and it's just a terrible loss that you have all the time. Med-surg nursing. People, think it's not, it's very stressful.
It's brutal.
They have, I think they think you're their waitress.
That's the thing. I think it's more the patient's attitudes in there
than the nurses on those floors.
I'm not going to degrade the care because they're doing a lot for these people.
Yeah.
But these people are healthier than an ICU. Sometimes ICUs, they're intubated. You might talk to the family, you're not talking to the patients. Med surge, oh, you're dealing with
they're good enough to be up and around and complaining.
Yeah, all the time.
Which, fine, you're sick, you can complain, but you can't berate a nurse, and you have way more patients. Like an ICU is 1-to-1 or 2-to-1.
Right, you're going to have 6 to 10.
Yeah, you can have a ton of patients. You are constantly behind. There is not enough time in the day to handle the amount of patients you have on a med surge floor.
And that's if everybody showed up.
Right, and back in the day in med surge floor, you might be in there for 10 days for, you had your appendix out. You're fine after day 2. Yeah. You're up and walking around. Now, these patients are no longer like, you're home. You don't stay in the hospital for an nappy. You're at home. Those patients aren't there. These patients are sick. I mean, not as sick as ICU, but they're
sicker than they normally would be.
It's more work.
Yeah.
And while some of the stress goes away, they said you become accustomed to your work. So you're like, okay, well, this is what it is. I have 8 patients. I have 8 hours. I got to get everything done. But there's unhelpful colleagues, unresponsive nurse managers, and you're unappreciated.
Mm-hmm. Completely
Unappreciated.
You got drug seekers, you got abusive people. I mean, my girlfriend, somebody took an IV pole and tried to swing it like a bat around the room. I mean, she tells me some stories. I'm like, holy shit.
Yeah, it's tough on the floors.
I'll take them asleep any day.
Yeah. And then psych nursing.
Oh my God. Though I did want to do psych nursing. If I didn't end up in the OR, I was going to do psych nursing. Till I was at one of the hospitals, and it was a mixed ward, so it was male, female. Guy was like 6'4", and I was like, if I'm 9 months pregnant and this guy loses his shit, I'm done. Yeah. Nope, I'm good. And I was like, I'm done. Nope, no psych nursing for me.
Yeah. So they said you're not only dealing with like the mental health problems that your patient has, but they're also some of these, like, it's med surg psych nursing, so they're sick. They have a physical and mental problems. It's like twice the amount of work.
Yeah. Detoxing, alcoholism. It's hard.
And the biggest stressor for them is the risk of violence.
Oh, yeah.
One study at a large psychiatric hospital, nearly 70% of the clinical staff members have been physically assaulted in the year.
And you don't see it coming with a psych patient.
Right. They're all of a sudden you've pally and they're joking around.
And then crock you in the head.
Yeah. And then long-term care nursing.
Yeah.
Is the number 10 on the list. And they often care for the same patients for years. Mm-hmm. They form a bond. But you know what's going to happen, but they don't get the compensation we get in hospitals. Their pay is way less. They have way more patients.
And these patients are difficult with dementia.
Yes, and they're violent.
And yes. And now you're not even getting financially compensated.
Right. And they have no staff that works. You might have one nurse to the floor with a bunch of nursing assistants who work hard, but it's just not enough.
Talk about turnover.
Oh my God. Burnout.
Forget you.
Yes. It says like the long-term care nurse is left feeling as she has to do all the work herself and never takes a break. And my grandmother was in a nursing home for a long time. She had Alzheimer's for a long time, and she was in a nursing home, and those women did not stop.
No,
they did not stop.
Yep. That's nursing I would never do.
No. The turnover rate is up to 75% in those units.
Yep.
So that's insane.
Yeah.
It's a hard job.
Yeah.
Give some nurses a break.
Burnout and bullying goes hand in hand. A couple of ways to maybe deal with the bullying is to gain an awareness of the depth and pervasiveness of how bad it is in your facility. Mm-hmm. You observe the interactions between staff. Start looking at how your preceptors are treating the staff. Mm-hmm. And try to model good behavior. We've had a couple of people coming up to us where we were warned, oh, you wait. And again, I told you I'm trying to turn over new leaves. So I was like, I'll wait and see myself. Mm-hmm. And I'm not seeing what those people were seeing. Yeah. Granted, our shift is just different. Mm-hmm. It's a different vibe. And I'm not saying they didn't see things, but we easily corrected some of what we saw just by try it this way. Do it this way. Mm-hmm. Instead of bringing them in an office and being really penal to them, we kind of corrected it in a different way, right. So I just feel like you got to remember you were new once too.
Yes.
And you're going to make mistakes. Mm-hmm. And I tell all the new people coming up, if you think You're going to go in on your own, and you're never going to make a mistake. You're delusional.
Yeah.
We all make mistakes.
Mm-hmm.
And it's going to take you 2 years before you're going to walk into a room and think, okay, I got this.
Yeah.
I said, I've been doing this a long time, and there are still rooms cases that come up, and I think I have no fucking idea what I'm doing in here, but I'll make it work.
Right.
So,
figure it out.
yeah, you can't, I think some of these students are very hard on themselves, and they expect to have the experience of a 30-year nurse in 3 months. And
they'll literally say, well, they do it, so well. Or, I'm like, yeah, they've been doing it for literally 30 years. I hope to God they're doing it well.
You're literally doing it longer than you've been alive.
Right. You have to relax.
Yeah, I was scrubbed the other day, and one of them was like, you make it look so seamless. I said, I've been scrubbing longer than you've been alive.
Mm-hmm.
I hope I get to know how to scrub a kidney by now.
Right.
Like, watch me do interventional radiology or vascular. Forget it.
Yeah.
I look like a hot mess.
Right.
But you give me an open case,
any day.
it looks like a goddamn ballet.
I am a rock star.
I am a rock star in an open case, but little by little, we'll never see those again.
I know, I hate it.
Provide education to staff about what civil behaviors are expected, especially when welcoming and onboarding new staff. We kind of tell them, like, this is what we expect from them.
Mm-hmm.
We expect you guys to hold them to the same level,
Mm-hmm.
but not to be cruel or unkind to them in any way.
We actually tell them, if there's a problem,
Call us.
call us and we will deal with it.
Yeah.
So you're not
It's not your role to discipline them.
stepping.
Right.
I mean, definitely say something, especially if something's unsafe. But if it's just something you're like, I don't know, I don't like that they're doing that. Like, talk to us about it, and we'll talk to them.
And I
because
think
we'll
that-
talk to them in a certain way.
I think that prevents that whole bullying atmosphere too. Because who are you? You're not
Right.
much newer.
Right.
You've been doing this maybe a year longer than they have. So,
Right.
Don't take it back. Try to be welcoming. Provide education and conflict management to staff to know how to deal with conflict. If you witness hostile or uncivil behaviors, speak one-on-one with the perpetrator in a calm, non-threatening, I can't do that, non-threatening way. Address what took place and coach them through an alternative approach. So if I find it's a major conflict, I pass it off to my manager because I can't approach people. I can't. I'm heated.
Yeah.
I get, emotional about something.
Right.
I'm never going to approach you in a non-confrontational way. I can't help myself. So, those are just a few things to try to help you. I'm sure do you have any tips on
Yeah, I have. So, for burnout, use your EPA, your employee assistance program. Every hospital has it. Get help. Talk to someone. Prioritize your mental health. Like, you have to, if you're feeling burnt out, what good are you if you're not helping yourself? You can't help other people if you can't help yourself.
Side note, the EPA helps people with everything. Financial matters, housing if you got kicked out.
Any problem you have, go to your EAP. Because
if you're being abused, it helps with so many issues.
Credit card debt.
Yes,
like
everything.
Will help you.
So, yes, I just want to make sure
use your
EPA for
they're
anything.
there. Don't suffer. Like, they're there. Use a sick day. Mental health is a health problem. So if you had a cold, you would call out sick. If you're having a day that you're like, I can't do it today,
go home and go to the spa.
Call out sick.
Yep.
Give yourself a day. Get your head together. If you need a break, you got to take one. Develop strong relationships. Have people you work with and people outside of work you can turn to. You have to be able to talk to people. I am feeling like shit. I can't do this anymore.
Mm-hmm.
I don't know what to do. I can't even, you need to talk about your stress. You need to talk about what's happening.
Go for a drink after work.
Right.
Reach out.
Yeah, we always say that. We see
go for water
shit
after
together
work.
that, we see shit you shouldn't see. And you can't, I can tell him. He has no idea. Mm-hmm. You have to talk to the people you work. You have to form bonds. And and I said to the new girls, like, you're 20-something. I said, when I came on nights, I was 20-something. One of my closest friends is my mother's age. Mm-hmm. It doesn't matter what age they are. It doesn't matter where they're from.
You're going through the
shit
same
you do
thing
together will bond you, but you have to reach out. You have to talk.
And you do things. We were always planning, let's go to the beach today.
Yes.
Let's go down to this today. Let's go out for dinner. Let's do a weekend. We always planned stuff because getting outside of the job and with your coworkers helps a bazillion times.
Yes.
You see a side of them you may not see at work. You vent, you joke, you laugh, and they're the only people you could do some really horrible jokes about things, and they're going to laugh and they're not going to judge.
Right.
So plan things, get out of the OR and do things together.
Right. And set boundaries. you need a work-life balance. When you are at work, you are fully there.
Mm-hmm.
When you are at home, you are fully home. You are not at work. Don't check your work emails.
Right.
Don't, you know.
I don't even have them on my phone.
I don't either. Don't call in and like, oh, do you, like.
You need somebody?
No,
You want me to come
like,
in?
you're home. Be home. You
Yep.
need a break. You cannot be worrying about work 24/7. Leave it at work.
Yeah.
We have a job where we can leave it at work. Leave it at work.
I don't even look at the phone. If those letters pop up, I'm like, oh, not answering.
And get exercise. Eat well. Sleep. You have to take care of yourself to take care of other people. You have to take care of yourself. And I got all that from nursejournal.org, sciencedirect.com, and Nurse Money Talk.
I got my articles because I do have stuff in my articles. Let's see. Our Own Worst Enemy, the Nurse Bullying Epidemic at Nursing Administrative Quarterly. AAPACN, American Association of Post-Acute Care Nursing, February 23rd, 2021. Why Nurses Eat Their Young and How to Stop This Damaging Practice. And Nurses Eat Their Young, an Insight into Systemic Hazing and its Implications on Patient Care.
Very good.
It's very
Just
in-depth.
don't do it. It makes you look like an ass. It
Yeah.
doesn't make you look any better.
Yeah.
It makes you look better to have helped somebody and make them better. And say,
we need nurses.
wow, you did a good job. And they'll say, you know what? Laura showed me how to do
Yep.
that. And they will say that.
Yeah.
Because you were kind to them. Like,
Yeah, I don't think they say Nicole showed me.
no, I don't mean.
I'm kidding.
No, they
I'm
do.
kidding. I know.
But you know, like, it's
Yeah.
just, it makes you look better.
Yeah,
If
and they're
you're
always
good
calling
to
us.
somebody.
Can you come in and help me with it? Yep. This is a stupid question. No, it's not a
No,
stupid
it's not.
question. We'll help you through whatever you need.
Right.
You know, bully, like I'll stand block between them and a nurse who might be aggressive. I'll stand block between them and a surgeon. We become their parents when
Right.
we're there. There's a shortage. It's a real thing.
Yes.
Okay? People
It's-
are leaving the field in droves. We need to protect the new ones coming in because we're going to be old and those are who are going to take care of us.
Right. And they said, like, what is this? It was like, the nursing shortage is accelerating.
At a ridiculous rate.
Yeah, and in 2030, it's going to be like a nightmare. The average age of a registered nurse is now 50 years old. The average nurse is 30 when they enter the profession. A lot of people, it's their second profession.
Yeah.
A third of today's nursing workforce will likely retire in the next 10 to 15
We're seeing
years.
them. We're losing 20 a year
Yeah.
to retirement.
A third of the nurse workforce will retire in the next 10 years. Nursing school faculty is also on the decline, and that limits the amount of people who can go into nursing
Right.
school. So you're not turning out 8 million
Right.
nurses because you don't have enough teachers to teach them, so they can only take small classes. A good percentage of nurses end up leaving the field before they're even retirement age. It's physically demanding.
It's a burnout.
Never mind mental and
Yep.
it's physically demanding.
I was walking up your stairs today, and I was like, my knees aren't going to last.
Yeah.
My knees
It's
aren't
bad.
going to last.
The turnover rates range from 8.8% to 37%, depending on the state. It's also called the most dangerous profession, not only because of workplace violence that occurs all the time, but also because the alarming rate of back injuries due to the lack of teamwork, limited resource, and the lack of equipment and training.
How many nurses trip in the OR? We lost one
Oh my
nurse. She tripped because anesthesia would drain the IV onto the floor.
Yeah, it was wet. And
She
slipped.
whipped her Achilles, never came, or her hamstring.
Hamstring.
Yeah, has never been back.
And she was an excellent, what a
Yep.
loss.
Yep.
Excellent nurse. But a lot of them, even if you can handle the physical and the mental, they're driven out because of the toxic work environments. We have to stop.
Doing this.
It's going to be worse. It's just going to get worse.
And to compound all that, it says something like the baby boomers are now all at the age of elderly.
We're getting more.
They're
The boomers,
the
which is the biggest generation, is all getting to the age where they're going to be in the hospitals.
They're all
Right.
sick.
Right.
You know, all those drugs from the 60s, man, catching up, dude.
Yes, man. But it's just, it's a real
Yeah.
problem. So why are we pushing people out?
I don't know.
Why do we not want
I
people
don't
to
know.
know? Not
I mean,
know
like
that?
I said, I see it with the scrub techs all the time, the way the other scrubs treat them. I'm like, I used to have this one surgeon, everybody that scrubbed for him thought they were the only ones that were going to scrub for him.
Mhm.
They'd leave and a new one would fill the shoes.
Someone
You
can
are
fill your
not
shoes. Yeah.
indisposable
No.
because I promise you the moment you leave,
Yeah.
it's a machine. Another one's going in your spot.
If I left tomorrow,
Somebody else would be doing
my
your job.
job.
Yep. Nobody
even knows.
nobody thinks, everybody thinks they're the only ones that can do it.
Right.
You are not the only one.
No.
And my girlfriend, her hospital's in dire straits. the CFO of the hospital or something, who's kind of running the hospital, said to her, well, why can't one of the circulators do 3 rooms? So you not only on top of everything else, you have people running the show who have no fucking idea how anything runs.
And that's the problem too, is it comes from the top down, like to stop the burnout, the managers and the people above the managers, they have to put things in place to prevent it.
But you have big conglomerate. Nursing in my career, in my own witness, has gone from medical based to business based. Yeah. Business is money. People running the business have no idea how medicine works. Right. Patients are not a variable that you can count on. They change. Things change. Right. They're sicker than you thought. They're staying in longer than you thought.
They had weird anatomy. Right. Now this whole surgery went to shit.
And they're basing policies and procedures on shit they can't control. Right. And they've made a mess of healthcare. Right. And that is contributing to the burnout. Right. And I mean, I could go on and on and on, but it drives me crazy when I see we got Tenet, we got Kaiser, and we've got another group starting up in the Northeast. You can't run it like a business. No, it's not money. It's people. Yeah. It makes me insane. These stupid surveys on the fucking floor. Do you think a drug-seeking patient is going to give that nurse, no matter how good she is, a good survey? No. And now the reimbursement's based on that? Right. That's bullshit. Yeah. That's complete bullshit. Yeah. Oh, I could go on. I'll fire it up now, Laura. I'll fire it up.
It's so it's just so
aggravating. It's aggravating to me because, like you said, I like my job. Yeah. I like what I do. I like being a nurse. I like telling people I'm a nurse. Mm-hmm. I just am so frustrated with... I'm glad I'm at the tail end of my career because when I started it, I loved my job. Yeah. I fucking loved my job. And I've seen them take what I love and destroy it. Yeah. And that's what I think is the worst for me, is like, it's never going to be where it was. The camaraderie, the level of care will never be what it was when I started.
Well, we also started at a time when we had like pensions and stuff, so people stayed.
Yes.
You stayed at one hospital your whole career, so you knew these people. Yeah. From the time they were young till the time they retired. And so you had
waited to get vested, and then you got vested. Now you're vested, so you're going to stay.
But you saw them have kids. You saw their kids grow. You saw their kids get married. You saw them have grandkids. You saw them through all these stages of their life, so you knew them.
Yep. You know everything about them.
It's the turnover rate. Well, in that, not only from that, but from burnout and everything else is so high. You don't get the chance to know people.
There's no reason for them to stay. No. And now with the travel nursing and the amount of money they're paying these travel nurses, we trained, 12 people? 5 of them have left to travel. And they're traveling, like when I traveled, you had to have 2 years experience. They wouldn't even look at you. Now, one of them wants to travel. I'm like, what are you going to tell me? You've done 1 fucking service. Right. You have no goddamn experience. Right. But they'll take her. Yeah. And they'll put her out there. And she's going to take care of you. Mm-hmm. And she doesn't know. No offense to her. She's a great nurse. No. She's great at what she does. But she needs more experience. Right. I mean, one of them's telling me, one of the travel nurses will only put the first name down on the chart. What?
Well, that's not legal.
Right. It doesn't understand why you have to put the last name down and doesn't want to do it. Right. How did you get this far in fucking nursing and not putting a last name down on the chart?
And the thing with these people not having experience is you're going to all these different settings. You don't know where anything is. Right. You don't know the rules
procedures.
There, the procedure. What happens then? If you have no experience, you're not given an orientation. When you go there as a traveler, you have to just go.
You might get a week.
But even then, it's not like a orientation.
In our hospital, we're spoiled, and they don't realize that too. Everything's done for us. You go to another hospital, the OR nurse is prepping. The OR nurses might be doing IVs and starting. We don't do that. No. The OR nurse might be bringing them back to the PACU. They may have to go, like...
They might work OR PACU.
Right. We never do any of that. No. You have no experience in that. What are you going to do? Right. You're a one-trick pony, and you're going to go travel? Right. Yeah, the money's great, but it's very dangerous, and your license is on the line. Right. So
and patient care, and that's the problem with the. I mean, go, you know what? Go get your money, whatever you want to do. But that's the problem, I think, with all the traveling that's happening now is no one knows what they're doing. You're taking us from Boston, sending us to California, where we don't know the hospitals, we don't know the patients, we don't know the culture, we don't know anything.
And you're taking California,
bringing them to Boston and paying them a shit ton of money.
Yeah, instead of just paying the people
and
that you work with.
not knowing anything there, where anybody works, you don't know anything. You're
and that puts
just moving people.
More pressure on the people who did stay.
Which just causes more burnout.
More burnout and more tension between the staff. Yeah. I'm not going to be nice to a traveler who's making $150 an hour when I'm not making that.
And I don't even know that it's not being nice, but you almost can't help it. Like, you want me to do the worst case.
You should be fucking doing it.
What I'm doing here because I've worked here for a million years. I know what I'm doing, so you're going to give me the shittiest rooms. And they're going to do the 3 things they know how to do, which are for
10 times the amount of money.
Way more money. Right. It just causes all this resentment and problems. And
instead of just investing back in your staff, bring pension plans back.
I was at brunch today with 2 other people that we work with. And I literally said, if they brought the goddamn pension plans back, it would bring it back. Like, people will be loyal. People will stay. People will want to work for your... They'll be proud of their workplace. You know, like,
but it's money. It's too much money.
I know. But it's not. You're paying these travelers $8 million.
But that's what kills me. They don't see that.
It's unreal.
They don't see that.
No, it's unreal.
You know, I can't. All right.
Anyway, we're rambling.
We could go on and on. Yeah. We could go on and on and on.
Be nice to people you work with. Teach people you work with. They will care for you someday. You want them to know what the hell they're doing.
Yep.
Don't keep it all a secret because it's going to go with you.
To those of you who wrote in, thank you.
Yes.
You were brave. Hopefully we respected your confidentiality. Your stories were horrific.
Awful.
And I hope you find a better experience, because I can tell you can come work where we work. We'll take good
care
of you. We need the nurses. We'll take good care of you. We'll train you in everything.
Yeah.
All right. We have another good episode coming up. And then after that's our 100th episode.
100th anniversary.
Anybody got ideas for our 100th anniversary?
100th anniversary.
We look fucking fantastic.
We look great.
So let us, send us some ideas or whatever you want to talk about. Maybe we'll talk geriatrics for 100. But it's 100th episode. I can't believe we've been doing 100 episodes.
I can't either. That's crazy. I literally can't.
My crazy little idea, and 100 episodes later, dude. And all those reels. Everybody's living the reels.
I miscounted the episodes.
All right, so we'll see you in a couple of weeks.
Bye.
Bye.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsnscrubs@gmail.com.